your host, Dr. Aftab Ahmed, with the program Innovative Pakistan with Dr. Aftab. And today is a very special day, and that day is World Hepatitis Day. In this day, we actually highlight the importance about hepatitis, that we should go for awareness about hepatitis. We should go about prevention of hepatitis and treatment. This is a special day with reference to Pakistan because now in Pakistan we have the highest prevalence of hepatitis in the world, and we also have the highest population of hepatitis C in the world. So that's why I think there is a more need that we should discuss in detail about hepatitis in Pakistan. And to discuss, we have an expert with us, Dr. Hassan Mahmood. And Dr. Hassan Mahmood is a very renowned scientist and doctor, which you can see on different forums with reference to health and especially about hepatitis. He is the country lead of Integral Global, and today we'll discuss in detail about hepatitis in the world and especially about Pakistan. And we'll also discuss that what are the government effort to eliminate hepatitis from Pakistan till 2030. So, as per the format of the program, normally we start the program with the introduction of our guest. So we normally ask our guests to introduce themselves, especially their educational journey and then their career journey, and then we start the discussion about the topic of today's talk.
Thank you very much, Dr. Aftab, for having me. I am Dr. Hassan Mahmood. I am a medical doctor and
Mhm.
public health professional. I did my MBBS from Pakistan.
Right.
Then I did my MPH from Cardiff, UK,
Hmm.
and
Excellent.
I started my professional career from 2011.
Hmm.
So
Nice.
I started working in different projects of public health,
Right.
and somehow hepatitis was always close to my heart because
Mhm.
when I was doing my house job,
Right.
so we used to see a lot of patients related to liver-related complications.
Right.
So from there, we gathered that there is some issue
Mhm.
regarding hepatitis in our country. Though at that time we were not that much, aware of the disease burden.
Right.
So even when I was doing my MPH from Cardiff, so my dissertation topic was on hepatitis C.
Mhm.
So that's how I started working on hepatitis. And then in 2013, I was selected by CDC USA as their consultant.
Wow.
And I started working with federal and provincial governments on hepatitis prevention and control.
Mhm.
So it's been almost 12 years, more than a decade, that I'm assisting my, people and system on hepatitis prevention and control. So that's my brief introduction.
Okay, excellent. So, Dr. Hassan, with the medical background and with the public health expertise, so he's mainly working on hepatitis for over a decade now. So he's actually he's the country lead of Integral Global. So
Yes.
can you please briefly explain to us that what is Integral Global and what is role of Integral
Sure,
Global in
sure.
hepatitis elimination?
So Integral Global is our organization, and it's a US based organization. Our
Hmm.
headquarters is in Atlanta,
Right,
but we have field offices in 7 different countries all over the world.
right.
And Pakistan is our flagship office,
Hmm.
where we are working on different public health projects, including hepatitis. So
Right.
we cover all the communicable, non-communicable diseases,
Hmm.
disease prevention and control, global health security, operational and logistics supports to the government and other international partners for the
Excellent.
implementation of different public health projects. So, Integral Global was founded in 2016, and it
Hmm.
started its functions in Pakistan since 2018.
Right.
So, it's pretty much on ground. So,
Hmm.
we believe in quality work,
Right.
and for hepatitis elimination, Integral Global is integral partner of government
Hmm.
on hepatitis elimination. So,
Okay.
yeah,
So actually, I think we should talk more about the strategical
sure,
discussion.
sure.
So the thing is, like, as we actually started our discussion, that Pakistan has the highest population of hepatitis C in the world. So why it happened? What do you think? What are the main reasons that we actually ended up into the highest population?
I can tell you the risk factors, and then you can understand that what are the possible reasons, and that would answer your question. So, we have different surveys. In
Mhm.
fact, three surveys, reputable surveys, have been done on the prevalence of hepatitis in the country. The
Right.
first was done by Pakistan Medical Research Council
Mhm.
in 2008.
Right.
That was a national survey all over the country.
Mhm.
Then the second was done in 2017 by the government of Punjab, and
Mhm.
third one was done in 2019 by
Okay.
government of Sindh and WHO.
Mhm.
So all these three surveys showed us that the most significant risk factors for the transmission of disease are unsafe blood transfusions,
Right.
reuse of therapeutic injections,
Mhm.
and use of unsafe medical and surgical instruments. When I
Right.
say unsafe, it means unsterilized or poorly sterilized
Right.
surgical or dental instruments or poor infection control.
Mhm.
The risk factors that we think a normal person think, barber or other tattooing or ear piercing,
Mhm.
those are community required risk factors, and they are in fourth, fifth, and sixth stage of the
Right.
transmission of disease. So
Mhm.
you can see the top three significant risk factors are coming from health sector itself.
Right. Okay.
So
That's really
yes,
alarming. Like
yes,
you go to whenever you have a disease, you go to any health facility, and
yes,
there are chances that you get the
of
infection
course,
from there. So that's really a challenge. And like WHO has a target of eliminating hepatitis from the world till 2030,
yeah,
and also is part of Sustainable Development Goals that we have to go for like all the health parameters,
agree.
especially in Pakistani perspective, we talk about the hepatitis. So what do you think where Pakistan is standing right now in the elimination of hepatitis as compared to like rest of the world? So you have like been part of a very
Yes,
important organization.
yeah.
You will have a very good perspective on that.
Dr. Aftab, I'm very hopeful, and
Mhm.
I believe that we have a very good chance of eliminating this disease.
Mhm.
And the reason why I'm saying this is that we have a very strong political commitment
Right.
and support from our federal government,
Mhm.
provincial governments, and everyone is on the same page for the eliminating of this disease.
Right.
But at the same time, we should keep in mind that when we have to deal with such a huge disease burden, I mean, I'm talking about almost 12 to 15 million people
Right.
who needs to be, treated or screened, and
Mhm.
if you have to eliminate this disease, that means you have to screen everyone who is above 12 years of age,
Right.
and roughly it is almost 170 million people.
Mhm.
So at least you have to approach 170 million people in order to screen them and know their disease status.
Right.
So you can imagine that how big task this is.
Right.
And a country having a very scarce and limited resources, and
Mhm.
fragmented health system,
Right.
and political I must say influidity also. So these are different challenges that we should also keep in mind.
Mhm.
Having said, I see a lot of commitment, as I mentioned earlier, from our
Mhm.
government and also from private sector.
Okay.
So if we start now, we
Mhm.
can definitely achieve these elimination targets by 2030.
Okay, excellent. So you was also you are the technical advisory
Ji,
part of technical advisory group to the Ministry of Health.
ji.
So you are also part of that policy. So what is the actually policy on the policy side? If we discuss, what is the policy that these approaches should be there to eliminate the hepatitis from Pakistan till 2030. So you would like, can you share the journey on what basis, like what was the data available and how you drafted that
Sure,
policy?
sure. That's a very good and pertinent question, Dr. Aftab. As I mentioned, when I started our team in 2013, I still remember that there were four provincial hepatitis control programs, because
Hmm.
when there was devolution in 2011,
Right.
there was a national program at that point of time.
Hmm.
So in devolution, that program was devolved to the provinces.
Right.
And then it was called Chief Minister's Hepatitis Control Program.
Hmm.
So the programs were doing their jobs, and when we visited them, they said that look, we are screening, testing, and treating people. So
Right.
we are the question you asked about the data.
Mhm.
We asked, could you please share the data that how many have been screened, tested, and treated?
Right.
So the data that were collected, Dr. Aftab, that showed us that that is much less than our targets
Mhm.
to achieve the elimination. For
Right.
example, if we had to screen, test, and treat 100 people,
Mhm.
we were screening, testing, and treated 10 people.
Right.
So you can imagine that was an eye opener for us.
Mhm.
Then we started thinking that how we should strategically cope with this disease.
Right.
So then TAG was formulated, Technical Advisory Group,
Mhm.
with representation from all the provinces and federal and academia, civil society, everyone.
Right.
So at that point of time, the first national hepatitis strategic framework was formulated with
Mhm.
the technical support of WHO
Okay.
and CDC USA, PHRC, and all the stakeholders and TAG, of course.
Mhm.
So that strategy gave us the targets in numbers that how many needs to be screened, tested, and treated
Right.
in a certain time frame.
Mhm.
That was the first strategic document that the country had, and in the region, we were the second after Morocco who had this, strategic guidance. But of course, you can understand different factors which were,
Mhm.
hurdles we couldn't achieve at that point of time. But that helped us in a way that in 2025, when we are sitting, I can see a lot of improvement and
Right.
a lot of improvement in terms from political support and from international community also.
Mhm.
Like I've been working on this disease for past many years, but now I can see that people have now get awareness, at least in urban settings,
Mhm.
that these are the risk factors,
Right. Mhm.
and if not a lot of people are treated in public sector, but many people are being treated in private sector.
Right.
If you see around yourself in the community or in society, you know
Mhm.
that everywhere, if someone has to get a job or whatsoever, they get screened for hepatitis.
Right.
And if they get positive, they get, treatment,
Mhm.
even if it is not available in public sector, in private sector.
Right.
But one thing I would like to highlight here, Dr. Aftab, is that data is the key.
Mhm.
Whatever I'm saying, if you ask me, Dr. Hassan, okay, you are saying you are very optimistic, just show me the numbers,
Right.
just show me the data. So my handicap is, Dr. Aftab, that I can share the data from the public sector with you. I
Right.
cannot share the data from private sector.
Mhm.
And that is, and in Pakistan, the major stakeholder is private sector.
Yes, it's like 60% of.
60%,
Mhm.
60 to 70% of the patient healthcare needs are being catered by private sector, and
Right.
it is not on the table.
Mhm.
You are missing 60-70% of the chance.
Right. So now in the recent policy and the
Ji.
recent effort that you are making, so you have integrated the private sector into
Yes,
that,
yes.
and now we
We
are going to have a national database.
Yes, we
Okay.
will have having national database. It is called Hepatitis Electronic Medical Record System
Mm-hmm.
(EMR system).
Right.
It's a very simple and easy to use system. It
Mm-hmm.
can be installed on smartphones, on tablets, on laptops. It can work offline. It can work without electricity.
Right.
So it will be used all over the country, covering public and private sectors both.
Okay. So in the start you have mentioned, so like going back into awareness and prevention. So you have mentioned that there are three main causes of hepatitis spread in the country. One
Ji.
is like unsafe injection use. Another is the
Blood safety.
unsterilized equipment and the blood transfusion.
Ji.
So like back into your house job, and currently
Ji.
you are like part of technical advisory group and you are like overseeing all the things.
Ji.
So how much improvement has been made in the prevention of hepatitis?
That's a tough question. Uh, there is improvement,
Mhm.
but not. But if we see different outbreaks,
Right.
the one that we had in 2019, the very recent one. So those outbreaks showed us that nothing has been done much on preventive side.
Mhm.
And the reason is, I must say that it's not only the healthcare system, it is the accountability system who
Mhm.
should ensure
Right.
the proper practices, of infection control and blood safety.
Mhm.
So here comes the roles of healthcare commissions, and we
Mhm.
had meetings with healthcare commissions.
Right.
We need to, Dr. Aftab, strengthen these commissions also.
Right.
I mean, if we talk to them and we discuss with them,
Mhm.
it's not that simple that healthcare commission personnel, they visit some quack and they shut it down. They say that within 1 week that person is still doing its practice, and
Right.
they get court orders.
Mhm.
So it's not that simple.
Right.
But as I mentioned earlier, things are being improved,
Mhm.
though these are slow,
Right.
not up to the mark.
Mhm.
But we can't say that there is no improvement. So I see improvement, but it needs to be
Yes,
expedited.
yeah.
Yeah,
So one of the things that you have just talked about is the healthcare system itself,
Ji.
and there are some loopholes in that, and they are resulting in spread of hepatitis and the outbreak that you
Ji.
have mentioned. So other component that is also very much into the spread, and this is how we actually get the data, is the barber system and
Ji.
saloons and so on. So what we have observed, like personally, over the last 20 years, I like sometimes they get the things and they put the UV machines for the sterilization, but after like some time it disappeared from that.
Ji.
So over the 20 years, so how to like improve that system? Is it role of the healthcare commission, or what ministry or what effort we have to make to aware the barbers and salons that you are actually leading to spread of infection? So I think that should also be part of measures for the prevention. So how we can do that?
Again, excellent question, and I'm really exciting to hear these questions because this is something that we want to, transmit or transfer to the masses through this electronic media, and I really like this question.
Mhm.
Uh, and the reason I'm liking it, Dr. Saab, is that we need to understand that hepatitis prevention, elimination, or any disease elimination
Mhm.
is a multi-sectoral response.
Right.
It is not the responsibility of one sector, one organization, or one institution.
Mhm.
I mean, there is no, doubt in this that health is, of course, health ministry, health system, health, whosoever are health custodian, they are the primarily the first custodian of this thing.
Mhm.
But at the same time, others, other department and other, institutions are also responsible for
Right.
this.
Mhm.
For example, our law and orders, institutions, our
Mhm.
district governments,
Right.
our people. If you're talking about barbers, there are barber unions.
Mhm.
There is someone who's, regulating these barber communities. So if
Right.
they just deliver these two, three messages that they don't have to reuse the blades or razors,
Mhm.
they have to sterilize their things, and they have to, ensure that transmission shouldn't be transmitted,
Right.
they will definitely act on this.
Mhm.
So it's a multi-sectoral thing, and
Mhm.
it's a responsibility of everyone.
Right. So now going to international
Ji.
scenario. So we have seen that Egypt
Ji,
has a
ji.
success story. So
Ji.
they have the one of the highest burden before
Sure.
Pakistan,
Ji,
and
ji.
they have eliminated the hepatitis. So how they have done it, and how we can learn from Egypt, and we can make things in Pakistan. So we also go and achieve the elimination. Although, as you have mentioned, that we have like our healthcare system is very fragile, so we have to improve that. And we have a huge population, as you have mentioned, that if we have to screen the people above 12 years of age, we have a population of 170 million. That's a huge,
Ji.
huge population. So screening everyone, and
Ji.
that's a huge challenge. So how we can learn from these international.
Doctor, the one liner about Egypt program is they thought and they did it.
Right.
You
Hmm.
know, they didn't take a lot of time
Okay.
of planning and other things. They just started and they did it.
Hmm.
They learned a lot. We were very closely working with them when they were, they started their journey.
Right. Mm-hmm.
So they learned a lot by doing elimination. I mean,
Mm-hmm.
it wasn't a very well planned program in the start,
Okay.
but the good thing is they were committed
Mm-hmm.
and they did it.
Right.
The lesson that we should learn from them is that we should also start immediately this thing.
Mm-hmm.
We shouldn't be thinking so much. I mean, we know our system, we know our challenges. So, if we'll think, spend a lot of time in thinking things and planning things,
Right.
then the work shouldn't be started.
Mm-hmm.
So that's one thing.
Mm-hmm.
The other thing we should also keep in mind that it's the first of all the population.
Mm-hmm.
They don't didn't have that much population.
Right.
That's a very significant thing to
Mm-hmm.
consider. And also they didn't have dogs of fragmented health system.
Right.
They have a national health system, so
Mm-hmm.
that was one thing that it should be done, and it was done.
Right.
So we have a fragmented health system. We have
Mm-hmm.
provinces, federating areas. We have to convince everyone
Mm-hmm.
to achieve any target. So these are two major factors that we should consider while doing our elimination.
Okay. So, going back, like with
Yeah,
your expertise in public health and working with international organizations, like you have worked with CDC,
yeah.
you have worked
WHO.
with WHO, Integral Global. So, one of the things, like you have mentioned that one of the survey was done by Pakistan Health Research
Yeah,
Council,
yeah,
and that was done back in 2008. And
yeah,
that survey they even projected that we have one of the highest burden of
yeah,
hepatitis B and
yeah,
C in the country. So, like back in 2008, the scenario was not very good in our country.
yeah.
So, why this program was started so late? Why we shouldn't like we should have made an effort earlier that we could have started this program, so we could save like millions of people in our country.
I agree. I agree with you, Dr. Aftab. But we must consider that even at that point of time,
Hmm.
uh, even after this survey that was done in 2008, I think at that time the Prime Minister initially called the team,
Hmm.
and he said that we have to launch a PM program at that time.
Right.
So the first PM program was launched in 2005.
Okay. Hmm.
The first national hepatitis program was launched in 2005, even before this survey.
Okay.
But when this survey was done, the PM specially took a notice, and he said that we should invest more resources on the program.
Hmm.
But again, there are two issues, Dr. Saab. First, we don't have that much resources, and we don't invest that much resources
Hmm.
into the health, and then on these deadly diseases.
Right.
That's one thing. And the other thing is, docs, are that at the same time we don't have data
Hmm.
to really understand that how many have been screen tested and treated so far.
Right.
We have a very limited data, and based on that data we do the modeling, and you
Hmm.
yourself know that modeling is all about assumptions.
Right.
So we don't know that maybe a lot of people have already been treated and
Right.
tested,
Hmm.
but uh, unfortunately we have only one way to prove that is we have to screen everyone. That is the
Right.
cost that we have to pay
Hmm.
for not having a good data.
Right. So in the world, there are two kind of scenarios.
Yeah,
One is we have seen in different countries. For example, in some of the countries, they have projected that there is a prevalence of like 3% have hepatitis C and 2% have hepatitis B. When they have done the actual screening, it was much less than they have projection.
yeah,
On the other side, in some of the African countries, I have gone through the recent data and the screening they have done in some of the villages in Central African countries. The scenario is totally different. Like in some of the areas, there was as high as more than 30% prevalence of hepatitis. So that's like, so they have projected that it will be around 5%, but the actual is 30%. So based on the work over the years that you have done, so we have now the projection like it's around 75%
yeah,
for C and around 2% for B. So
yeah.
what do you think? What is like your own how you can foresee what will be the scenario in Pakistan before like actually doing the testing? So what do you think in Pakistan?
Uh, um, I think it will be almost similar to whatever we are projecting right now
Hmm.
because we have recent surveys in 2017 and 19
Right.
in two major populous provinces of the country, Punjab and Sindh.
Hmm.
And the situation was almost the same. And
Right.
this figure 7.5 comes from those surveys also.
Okay.
So, but situation can be changed in Balochistan.
Hmm.
Situation can be different in AJK,
Right.
GB,
Hmm.
KP,
Right.
because the only survey that was done in these regions or provinces was in 2008, 17 years back.
Right.
So it could be more,
Hmm.
the prevalence, and it could be less.
Okay.
So, yeah.
So, like I was also part
जी
of the meeting for the start of this hepatitis elimination program in
जी जी
Pakistan, and the data was shown there, and then it was said that we are going to start some pilot studies,
जी
and
जी
you are also part of
जी
those
जी
pilot studies. So we are lucky to have you on this
जी जी
World Hepatitis Day. That you are our guest, and you are like very much linked to all the things which is happening in Pakistan. Thank you very much for joining us for
Thanks for
that.
having me.
And can you please tell us, like,
जी
what is the current status? What pilot project you have done? How much was the number? What is the prevalence? And what will be in the future? What will be the next step?
So we have completed our pilot in GB,
Mm-hmm.
Gilgit Baltistan. Then we are doing another pilot in Sindh,
Mm-hmm.
and we are planning another two in AJK and Balochistan.
Right.
So as I mentioned earlier, the prevalence was much less than we expected in GB.
Okay.
That was less than 1%.
Mm-hmm.
But in Khairpur, it is again much more than we expected.
Right.
So, but at the same time, Doctor, let me explain the intent or purpose of having these pilot projects.
Mm-hmm.
We shouldn't be confusing the aim or intent of these pilot projects with accessing the disease burden.
Right.
That is not the first intent. Of course, that's a good result that we get from these pilots, that we get latest disease burden prevalence or estimations, or not estimation numbers, but the real intent or purpose of these pilots is to understand the implementation mechanisms,
Right.
to understand the on ground challenges, to
Mm-hmm.
understand the real situation, that how, when the program, the PM program or national program will be launched,
Mm-hmm.
how it can be harbored
Right.
on different, provinces and regions, because we have so much diversity, ethnicity wise,
Mm-hmm.
geographical, demographical. So, and these pilots are also very helpful
Right.
in giving us that information.
Mm-hmm.
And accordingly, we are making changes and tweaking our national policy.
Okay.
So, yeah, these pilots are really helpful in revising and improving our national policy or strategy.
So when do you think will be the full-scale launch of the screening, testing, and treatment?
I think, inshallah, I'm very hopeful that this year it will be. It
It will
will
be.
be, if everything goes as per our plan, inshallah, very soon, within next few months, we'll be able to launch it nationwide,
Okay,
inshallah.
okay, that's excellent. So now coming towards one of the sector that you have discussed earlier is the private sector,
Ji,
and not only the private sector. You know, in Pakistan, we have many organizations which are very active against hepatitis. As we know that there is a health foundation,
ji, ji,
there is a network of Al Khidmat Foundation, there is a network of Indus Hospital, and many other organizations which are working. Some are like very much localized, some are have a national approach. So how you are going to integrate these organizations because you know so far if we see that even these single organization they are screening like 200,000 people or more than 200,000 people per year, so that's a huge number. I think they can be for me I think they can play an important role. So how you are going to integrate them and what impact they will create in the long run.
First of all, we cannot deny the importance and important contributions from the private sector. They
Hmm.
are the major stakeholders in our system and in our healthcare settings. Dr. Saab, we have started from the mapping of all these big stakeholders, not only big, even whosoever is working on hepatitis.
Right.
We have started mapping them, and
Mm-hmm.
you are aware that we have a list
Right.
of all the stakeholders, and we are welcoming everyone
Mm-hmm.
to join us in this cause. So we have the list of everyone with us.
Right.
We have designated a few experts within
Mm-hmm.
our tag
Mm-hmm.
who should be spearheading this process of including, these all these stakeholders, private stakeholders,
Mm-hmm.
for this national cause. But again, my point is that pri- we when we discuss this and when we come on a table, we everyone there is an intent,
Mm-hmm.
everyone wants to work. Private sector wants to work with government. Government wants to work with private sector.
Right.
But when we really want to materialize this or actualize this,
Mm-hmm.
somehow things don't turn up as they are intended.
Right.
You know,
Mm-hmm.
I'm not saying because of the bad intentions.
Mm-hmm.
Intentions are purely good, and we don't have any doubt about this. I think there are some mechanisms or implementation things
Mm-hmm.
that there are certain gaps that are not bridged or that are not filled
Right.
to bring this marriage together, and
Mm-hmm.
we have to work on those gaps. That how we can plug those gaps.
Definitely, because as you have mentioned that we have a huge population to
जी
screen,
जी जी
it's a huge number, and I was also going through the data. So we can definitely on-spot testing, we can do that. But if we see the PCR facility, because that's also part of the component that those who are positive, they should also go for the PCR testing. And I have seen that in Pakistan is like still is less than the capacity that is needed
जी
for the number of patients we will be expecting. So for that, I think it's very important to integrate all the stakeholders. They should join
बिल्कुल
hands, and because this is a national effort, and just like you have mentioned that Egypt, they have decided and they have done it. So
yes
similarly, Pakistan, all the stakeholders should come together, and if we'll be doing together, definitely we
इंशाल्लाह
can overcome this scenario. So other concern that is like
जी
I was talking to few of the organization, and they have mentioned that we have right now the funding for this program till 2027. So we will not have like funding till 2030. So what do you think for the funding? Because you are very much linked to the government and the funding. So this is like one of the concerns. So how we can like aware the people that we will arrange the funding. I don't know what is the exact scenario, but you can like better explain that.
Again, Doksa, we, our group and our team at national, federal level, and even from provinces.
Hmm.
When I say our team at national level, it has our, representations from provinces also, and government and private sector both.
Hmm.
So we all are very hopeful, and we think that when the program will start it at national level, definitely, international donors will come in.
Hmm.
They will definitely notice that this is a huge cause and these many people are being affected. And if government is going to invest this much amount of money on
Hmm.
ground, they will definitely come up. And we are already in negotiations with certain donors. I cannot disclose their names,
Hmm.
but we are very hopeful that once we'll start it, international community will join us and we will able to get some funding to cover the remaining 50% of the population. And God forbid if it doesn't come in,
Hmm.
we are very much hopeful that our government will definitely take this initiative and we will pursue this beyond 27,
Hmm.
and we'll be able to eliminate it in next 3 years by 2030.
Hmm.
So it's there, but we hope that inshallah international donors will come in, because they, from donors' perspective, let me tell you, and I'm sure you are aware of that. But for the sake of our audience, that international community is always interested to see that how much the local or national government is interested in
Right.
eliminating this disease.
Hmm.
So when they see that once the government has invested, they definitely come in and join the hands of government. And our government is also trying its best to negotiate and to have dialogues with
Hmm.
these donors or international community to support them
Hmm.
in eliminating this disease by 2030.
Okay, excellent. So one of the other thing which is like linked to the previous discussion that we are already having. So one of the component for this program is going for screening, testing, and treatment.
जी
So what are the other component of this program? One of the things that we were discussing, there is a need of massive awareness.
जी
There is a need of like working with other ministries so we can like aware those people just like we were talking about the barbers. We have to improve the healthcare system because over the years that like working in different hospital I have seen one of the things that you have mentioned like unsterilized equipment.
जी
So in some cases uh, the autoclave or other
जी
sterilization
जी
equipment they are malfunctioning and there is no proper sterilization. So one of the common like we also have to ensure that there is no more spread of the disease because on one side we are preventing it, we are testing, treating the people, but like it should. I'm not aware, but like you will
sure
be.
sure
You can you please highlight that
sure.
what are the other component of this program?
So let me give you a brief gist of this program.
Hmm.
Doctor, this program is not a vertical program.
Right.
This program is an additional support to the already existing system and services.
Right.
What I mean is that currently we, as I mentioned earlier, we have provincial hepatitis control program.
Hmm.
We have their infrastructure. We have their HR who are
Right.
already working on
Hmm.
these lines.
Right.
The only issue is that they are not screening, testing, and treating up to the mark.
Right.
So the thing that they are lacking was commodities. They
Hmm.
didn't have enough screening kits, testing kits, and medicines.
Right.
But they have enough HR and infrastructure to support these services.
Hmm.
So this program covers that gap. This
Right.
program gives them those missing
Hmm.
commodities in terms of screening kits, testing kits, and treating kits,
Right.
treating medicines.
Hmm.
The other thing is data.
Hmm.
So Punjab is the only province, Dr. Saab, who is using electronic medical record system EMR.
Okay.
Rest of the country is still using paper-based data system,
Hmm.
and that paper-based data has a lot of errors.
Right.
So there is no standardized data collection or collating procedure. So
Hmm.
this program, through this PM program,
Hmm.
we are strengthening all the country on a standardized EMR system.
Okay.
That's another thing.
Hmm.
The other aspect of prevention and awareness raising that you mentioned is also covered through this program by establishing a dedicated project management unit at federal level.
Right.
So it has a full team
Hmm.
led by project director
Okay.
and project its own project manager
Hmm.
and other staff who will be talking to the provincial hepatitis control program and other ministries and sectors on
Right.
different areas. For
Hmm.
example, infection control programs are there,
Hmm.
blood safety programs are there.
Right.
So they'll be talking to these programs, healthcare commissions, to
Right.
strengthen these preventive interventions and programs in order to cover the preventive coverage.
That's really excellent, and this is how it should be
जी
done. And I think this is a great initiative. And the part of technical advisory group is always there to support. Like these are the loopholes, and this is how we should work. Uh, at the end, we would like to know that how the process will work. This is for the like all the people who are going to be screened. So how this process will be done, as you have done like pilot in GB and you are doing another in SIN. So after like all these pilots, there will be massive screening in Pakistan.
जी
So can you, for the lay people, laymen, uh, how this will be done? Is there is like screening? What will happen afterwards? Will they get some certificates, just like we were going to
जी
get some polio
जी जी
certificate,
जी
sorry,
जी
the corona certificates
कोविड
and so on.
सर्टिफिकेट.
Yeah. So and the treatment. So how the treatment will be done? Is it free of cost? And what all the details?
So everything will be free of the cost for the people,
Hmm.
for the nationals of the country.
Right.
So everyone who is 12 years old or above will be eligible to be screened or
Hmm.
enrolled through this program.
Right.
So this program will cover 50% of the population.
Hmm.
So in dialogue or in consultation with provinces, we
Right.
have identified 50% of the districts within the country
Okay.
which shall be screened in first phase, I mean in next 3 years,
Hmm.
and whatsoever districts have been identified, they will be 100% screened. You know
Okay.
what I mean?
Mm-hmm.
So if we have, for example, we have selected Islamabad or ICT,
Right.
so ICT will be 100% screened, tested, and
Okay.
treated.
Mm-hmm.
So people will be, educated on being screened
Right.
through active and passive screening, both approaches. So
Mm-hmm.
active screening is that the system goes to the doorsteps, to the
Right.
people,
Mm-hmm.
and they screen them on their doorstep. And passive screening is people come to the system or the
Mm-hmm.
facilities and they get screened.
Right.
So it will be a mixed approach
Mm-hmm.
but the preferred approach is, of course, passive screening,
Right.
that people should be urged to come to the system and get screened, because that is more cost effective approach.
Right.
But at the same time, you understand our country's dynamics, that it's not easy to bring in 100% of the people to the
Definitely.
survey. So you have to approach them.
Mm-hmm.
So, Dr. Whosoever is screened
Mm-hmm.
positive, they will be further tested
Mm-hmm.
for disease confirmation, because screening gives you only initial information about exposure of the disease.
Right.
So that needs to be confirmed through testing.
Right.
So once a person is tested positive, he
Mm-hmm.
or she will be given free of cost treatment depending on their disease stage.
Right.
It's 12 weeks to 24-week
Mm-hmm.
treatment, and it will be free of cost.
Right.
And as you mentioned, whosoever are negative at
Mm-hmm.
any stage, screening negative or testing negative, they will be given a certificate. We are
Right.
thinking to give them, because it also involves some cost.
Mm-hmm.
But of course, at the moment, we are very much intending to give them a certificate that they are negative, and of course, a set of precautions that how they can prevent themselves further from the disease.
Right.
And who are cured,
Mm-hmm.
they shall also be given a cure
Mm-hmm.
certificate of cure, like you mentioned for
Right.
COVID,
Mm-hmm.
that they are disease free. So yeah, this is the main gist of the program.
So excellent. So for all the lay people, so this will be done like for in the first phase, as you have
Ji,
mentioned, for the 50 districts, and it will be 100% screening, and
ji.
all like screening.
50%.
If you are like going for screening, if you are unfortunately if you are positive for the hepatitis, then you will get free treatment. So
Ji,
screening is free, treatment is free. So that's I think
ji.
is a good opportunity for all the people of Pakistan that they should come forward and they should avail this very good opportunity that's being like in if we talk about internationally. I know that the treatment is very expensive,
It's
even the
very
screening is
expensive.
expensive,
Ji,
but the treatment is super expensive, but the government has made an effort that you will get free of cost treatment, and I think everybody should avail this excellent opportunity that they should get tested, they should get screened, and then they should get the free treatment for the disease. So are you going to like only diagnose for hepatitis C, or are you going to diagnose for hepatitis B as well, or
uh,
HIV? Because we are also like having some outbreaks of HIV in our
Ji.
country. So is it only for specific for hepatitis C or
Right now, it is only for hepatitis C.
okay?
And the reason is that hepatitis C has a less treatment duration as
Hmm.
compared to HIV and hepatitis B.
Right.
Because, as I mentioned earlier, C is treated within 12 to 24 weeks,
Hmm.
while hepatitis B and HIV, they need lifelong treatment. And also, a lot of stigma is associated with these diseases, with HIV and hepatitis B also.
Hmm.
So, to start with, we thought that we should pick low hanging fruit, which
Right.
is hepatitis C.
Hmm.
So, currently, it is only for hepatitis C.
Right. So, thank you very much, Dr. Hassan, for
Thank you, Ji.
joining us today in the studio of FM 87.6. And we were really delighted to have such an expert in our studio who talked in detail about hepatitis C and also the other hepatitis in our country. What are the government strategies, how they are going to implement the program. He talked about the pilot program that they have started. And after these pilot programs, they are going to start the massive screening, testing, and treatment all over the country. So the things are like things are. He is very much positive that we will eliminate hepatitis till 2030. So at the end, we will request you that as today is World Hepatitis Day, so what is your message for our community that about World Hepatitis Day? So what you would like to say?
First, thank you very much, Doctor, for having me. And my message is just be hopeful.
Mhm.
And we agree that it's a deadly disease,
Yeah.
but at the same time, we believe that as a nation, we are a strong nation, and history has proven that we have faced, controlled many challenges together.
Right.
So we will deal with this together, and
Mhm.
inshallah, we'll be able to eliminate it by 2030. The only thing that is needed is that we have to work as a nation together on this.
So, with the very beautiful message that we have faced so many challenges, this is one of the challenge for our country, unfortunately, because on international dialogue, it is said that Pakistan has the highest prevalence and the highest population of hepatitis C. So that's really a challenge for our country. So everybody now should step forward, and we have to do go for like awareness, screening, testing, and treatment. And once again, at the end, I'm really thankful to Dr. Hassan Mahmood, who is country lead of Integral Global, and he's also part of technical advisory group of Ministry of Health. So thank you very much, Dr. Saab,
Thank you.
once again for coming to the studio, for sparing time on
Thank you.
this very important day. And we had a very good, insightful discussion about hepatitis in Pakistan and how we can eliminate, especially the government efforts for the elimination of hepatitis from the country. So stay tuned with us. We have another program about hepatitis that will be with a gastroenterologist after the news break. So in that program, we are going to discuss about awareness, uh, prevention, and treatment in detail. So stay tuned on FM 87.6. This is your host, Dr. Aftab Ahmed. So join us after the news break.